very familiar with what that is because it's not a very common term. What that means is that in everything that we do, we utilize methods and materials that we recognize are going to have a positive effect on the patient's overall health. So we always take that into consideration with what we do. We haven't always practiced that way. And Angie can attest to this because she's been with me the longest. I've practiced for 18 years, but only within the last 3 years have we began this paradigm shift, as Angie said. And it really came out of my own personal health experience. Began with a regular mammogram, and then was called back for another, and then called back for another. And after, I don't know, the 100th one, it felt like, was called in for a biopsy, and then was called in for another biopsy. And then ended in surgery that involved 2 separate lumpectomies. And the diagnosis was atypical lobular hyperplasia and atypical ductal hyperplasia. So I had 2 different types, precancer, not cancer, thank the Lord, but definitely precancer. And my physician told me that having one type increased my risks of developing breast cancer by 40%, and having 2 types, her comment was, well, you can do the math. So I didn't really like those odds. And at my age, where I felt like I was a relatively healthy person, I mean, Joey and I were running marathons, you know, I just thought, what is going on? And then reflecting back over my health history from about 10 years prior, I recognized kind of this downhill scenarios, different events, adult onset asthma, pneumonia, an emergency appendectomy. I mean, just things that when I step back to evaluate, something's just not quite right. So it caused me to pause and really reflect on what is my own lifestyle, because running does not give you permission to go eat whatever you want. And that's what I did. I did. I'm going to run it off. So anyway, it began this process of me pursuing a holistic health practice degree and reflecting on my overall health, and then realizing, oh, I am a healthcare provider. And was very much a traditional dentist at the time, and very unfulfilled in that. I mean, I very much admit I was ready to quit because I just wasn't happy being a patchwork dentist. And so when I realized that, hey, you know, we need to make some changes, that's when I decided it's time to take care of patients the same way I'm starting to take care of myself. So lots of education, a ton of continuing education, a huge shift in thinking of how we do things and going back to the root cause of problems. Now some of the things that we offer now, we do a cone beam CT scan on every patient that comes through our doors. We do that because it's the only way that we can really diagnose asymptomatic infections around teeth. And there's a study that I put in your all's folders for those of you who like to read studies that came out in 2013 that is connecting heart attack victims, and what they did is they tested the clots that came out from the infarctions, and 50% of them had a bacteria in them that could only come from an infected tooth. And so when you look at the fact that cardiovascular disease is the #1 killer in our country, and we could prevent 50% of them, yes, you're going to get a CT scan because they're most of the time asymptomatic. So what a privilege that we can do that, and if we can have an impact on that statistic, then what a privilege. So that's one of the things that we do. Another thing that we do that's very different from a traditional dental office is that when we remove mercury, we've got gas masks on. That patient is covered. That patient has oxygen on. We're not breathing it, and they're not breathing it, and that's huge. Mercury is a known neurotoxin, and it's put 2 inches from a patient's brain, and then releasing vapor for however many years it's there, and then a dentist goes in and takes it out, and just an entire cloud of vapor enveloping the entire room. So that is not a healthy situation in any way that you look at that. And so we utilize a safe mercury removal technique in doing that to protect our patients as well as us, because we're exposed to it every day. We do an NMR home sleep study. We send that home with patients so that we can get realistic results on their sleep studies, that they're not in some foreign place and wired for sound and woken up every hour. So we do that, and then if they come back with mild to moderate results for apnea, then we give them dental appliances to help with that. If not, then I need help with who to send them to for the more severe cases. So that's one of the things that we're noticing holes with. Kristen, I want you to talk a little bit, because that's the dental side of things. But our hygiene side, for just our regular 6-month recares are very, very different. So I want you to share a little bit about what you do in there.
Patients on the snoot of the mouth, but it is indeed connected to the rest of the body. And I don't take inflammation in the mouth lightly. We talk about that. That's where I feel like we need a lot of help too when I have a lot of conversations with my patients about their health and their overall health. And they will frequently tell me maybe their story and how they've gone down a certain road and they are disappointed and they're frustrated and they're still ill. And they're asking me, what do you think? Where can I go? What can I do? So I'm really excited for this experience that I can go here and then have some relationships so I can pick your brain too. So yes. We talk about cardiovascular disease all the time. One of the really fun things we've got here is the microscope. So we can literally grab a quick plaque sample and look at it under the microscope, and it's a fabulous objective tool. And just what's happening right now. Let's just look at it and see what's going on. We talk about that. It takes a lot of time. I love to do that. I didn't want to do anything else anymore. I just want to look at the microscope.
She likes to look at
She
that.
wants to paint amoebas on her wall.
She does.
I'm done with everything else. It's all about the microscope. Ozone. We use a ton of ozone, so we love that as well. So I'm just thankful that you're here, and I want to meet some people and some like-minded people and gather information.
So enough about us. That is why you're here. You've been mentioned by name by patients. It's one reason that you would get on a list for us to invite you. We started asking the patients that did have good resources, who do you see? Where do you go? Because we have noticed patients are asking us, where do we go when we're dealing with cardiovascular disease, or where do we go if we've got autoimmune disorders, or we've got thyroid dysfunction, or run the gamut. They want someone that's going to listen to them, that's going to spend time with them, and that's going to address their overall care, not just this, we're going to put a patch here and I don't deal with the rest of you, but someone that encompasses their entire holistic care. So that's why we're doing this, because it's a void for our patients, and we want to be able to intelligently and confidently refer them out to people that we know will take that same kind of care with them. So that's why you're here. That's why you've been invited. And so we're so thankful that you came tonight. Part of our vision for this group is to develop collaborative care for our patients, so that I can share with you, hey, this is what we're doing, this is what we're dealing with, these are their problems, this is my scope, this is where I need help, this is not my scope of care, so where can that type of collaborative care for then someone else to pick up the ball and taking good care of them in that same way. Another way that I'm seeing this group is I want to learn from all of you. I mean, there's so much out there, and I've become a little bit of a continuing ed junkie. My husband, where are you going next weekend? And what are you learning? I mean, I can't read enough. I mean, it's kind of something you get started on, and it's just, the ball just starts rolling, and there's just more and more and more. And there's so much that, if you're a jack of all trades, and you're a master of nothing. And so I want to really stay concentrated on what I'm a master of and leave the rest to someone else. And so that's why I want to do this. I see us having meetings where, I want to hear from each one of you. I want to know what you do. I want to know what you're passionate about and what you specialize in. And I want to hear that, so it's not just us up here talking. I also think it'd be great if we presented some cases. If you brought in someone that was real challenging and we sat down and talked about, well, if they're having nervous system orders and they've got mercury in their mouth, that should probably be addressed. Things like that. And then I think it'd be really great, and I have even had patients request this, if we could have 1 or 2 meetings a year where we had a panel of presenters that could talk about one particular subject. I mean, patients would be all over that just to come in and sit down and have an opportunity to learn themselves, because what I have found is these patients, they come in well educated. They have done their research, they know, and they want answers beyond what they can learn online. And so we had talked about that with a couple of patients, and one just about came out of the chair. She was so excited about the opportunity, and she drives 2.5 hours to come here. So, and I'm sure you guys see that too. I'm sure you have patients that seek you out. So that's kind of what I see this looking like, very organically growing this, and willing to make it change and move for whatever works for all of us. But that's where I'd like to begin. I'd like to have our next meeting in January, and I'm looking at the 17th. I'm not sure yet. I'll send out some potential dates, but I want to hear back from all of you because I want it to be a time that everyone can come. And what?
Can I say something?
Yes.
I love you, but yes, I also want to say something. No. There's a name for this group.
I'm sorry. Yes, the Holistic Health Alliance of Tulsa. Isn't that great? I didn't come up with that. I'm not going to take credit for that, but I thought that was awesome. I was like, you got it.
Thinking of the Tulsa Health, but